The United States Agency for International Development Administrator Rajiv Shah recently returned from a fact-finding trip to the Horn of Africa. In an exclusive interview with VOA's Vidushi Sinha, Shah outlines USAID's plans to address the food crisis.
The famine in Somalia right now, and really the drought, which is the worst drought in 60 years throughout the Horn of Africa, is affecting 11.5 million people and puts millions of children at real risk of severe acute malnutrition, disease, and ultimately death. And we know how to prevent that. We know how to work to get kids vaccines and health interventions so they're protected. More importantly, we know how to invest in agriculture and agricultural development over the long term, as we do through the President's Feed the Future initiative, so that we don't have to live through these types of famines again and again. Right now, the Obama administration has aggressively supported the introduction of 2 new vaccines for diarrhea and pneumonia. For the first time in human history, every child around the world will have access to new vaccines when they become available here in the developed world. And we think getting those vaccines to those children will help save tens of thousands of lives right now. So I was just at the Dadaab refugee camp, and we're working to make sure those kids get pneumococcal conjugate and rotavirus vaccines and a range of other vaccinations so that they are protected against disease at a time when, because of severe malnutrition, they are immunodeficient and quite vulnerable. Well, the humanitarian emergency is of tremendous magnitude, and the United States has put in place a famine early warning system that allowed us way back in October to begin planning and investing in helping communities and children and women support themselves so they don't fall into severe acute malnutrition. We think those efforts have helped protect 4.5 million people so that they're not as vulnerable today as they otherwise would be, because we've been working with them to get them access to high-value protein and diets that will protect them through this critical drought period. In terms of severe acute malnutrition for the children, I was just in the Dadaab refugee camp. I met kids who had been part of 30 or 40-day treks from central Somalia to Dadaab. They break your heart. They are very, very malnourished. Their survival depends on our health and food interventions and the commitment of their families. It's an extraordinary time, and we really do need the entire world to step up and do more. The United States has been the largest, by far, humanitarian actor during this crisis, and we're currently working with donor governments around the world to encourage them to do more at a time of critical need.
That was Dr. Rajiv Shah of the U.S. Agency for International Development. He was speaking with VOA's Vidushi Sinha. Now, at least 25 people were found dead on a boat that arrived on the Italian island of Lampedusa today, according to Reuters News. The vessel was carrying nearly 300 migrants from Africa. Survivors say the adult men who died were crowded into a compartment and killed by fumes from an engine. But port officials say the cause of death is not known at this time, and medical tests are being conducted. The boat departed from Libya 3 days ago. For more information on any of today's stories, please visit us online at voaafrica.com. You can also visit us on Facebook. Just search for In Focus.